One of my favorite quotes from an early psychology class is that your brain is a lying liar. It is amazing the lengths it will go to trick you, deceive you, and distort your reality. Someone living with a mental illness is at a constant war with their own brain and their environment. Most will consider themselves their own worst enemy. In such a controversial field such as mental health, it is so important to continually strive to understand more about the disorder and the individual. This presentation will specifically cover clinical interventions for a person with borderline personality disorder. We will also delve into the mind of someone with this illness in order to gain some perspective and, more importantly, gain some passion and empathy. In an article written by Kayla Wright, she explains firsthand what it is like to live with borderline personality disorder. This is how she describes the inside of her mind. It is not warm or welcoming. It is cold and uninviting, yet so many people live there. Someone is always talking, usually more than one someone at once, and they never get along. There is the dominant one, the manipulator. This is what she sounds like inside my head. My therapist hasn't shown much interest lately. Why don't we pretend to be worse than I am? Maybe hurt myself, or say that I'm going to kill myself? My friend doesn't seem to be making me a priority lately. Why don't we breed lies and secrets against her to her other friends? My friend and I are drifting apart. We need a secret to pull us together. Let's make something up. This sick person takes over my body, and I sit back and watch as she ruins my life. Can you imagine constantly being bombarded by thoughts like these that make no logical sense? They rule your life and ruin your relationships. People with this disorder have a hard time trusting anyone. They have a continual struggle in their mind between being terrified of personal connections and strongly desiring them. The opposite sides are extreme. Either relationships are life-threatening or they are life-saving. The inner turmoil that this creates is immense. This makes treatment and success for people with borderline personality disorder very, very challenging. Symptoms of borderline personality disorder are often accelerated by emotional trauma in early life. Caregivers notice the manipulative behavior and emotional outbursts and often take it out on the person because they become frustrated. They call the person narcissistic, irresponsible, fickle, attention-seeking. They call them liars. They say things like, "It's all in your head and you are not normal." Sadly, these things were conveyed by mental health professionals as well in the early development of psychotherapy. Psychiatrists saw patients with these challenging symptoms and attributed them to narcissism and deviance. In the past, we had so-called rehabilitation centers, such as Pineland in Maine. These institutions claimed that they were treating people with mental illness, when in reality they locked people away with little hope of any treatment or cure. People were considered abnormal, mentally deficient, and incurable. It wasn't until the 1990s that borderline personality disorder officially had a diagnostic criteria. A shift happened where people started becoming more empathetic towards these clients and actually started looking into successful treatment options. The two most successful therapies used today are cognitive behavioral therapy and dialectical behavioral therapy. Cognitive behavioral therapy, or CBT, practices the art of reframing, which revisits past negative experiences or emotions and attempts to reframe them into a positive. For example, if someone thinks, "I hate that person and they are dead to me," a therapist would work on reframing the sentiment into, "I will try to understand what happened in our relationship and try to forgive." In dialectical behavioral therapy, or DBT, it focuses on practicing the art of mindfulness, similar to the staples that are found in Buddhism. The therapist works with the client to identify and validate emotions instead of seeking instant gratification through things like self-harm and emotional outbursts. You might be asking yourself, why is successful treatment such an important issue? The sad truth is that individuals with borderline personality disorder have a significantly increased risk for suicide and self-harm. BPD is unique as it is the only mental illness to have suicidality and self-harm as a diagnostic criteria. Patients use self-harm in a way of escaping reality, a cry for help, or simply wanting to feel something. The symptoms of the disorder create intense feelings of loneliness and abandonment, and unfortunately those feelings can lead to someone taking their own life through suicide. Sadly, it has been found that over 75% of people with borderline personality disorder have attempted suicide in their lifetime. A person with borderline personality disorder can also develop what's called a co-occurring disorder, which is a dual diagnosis. Most common are substance abuse and depression. These develop because a person with BPD feels as though they can't regulate their emotions and often become detached from their sense of self. They just assume that that's the way it's going to be. That's the way it's always been. That's the way it's always going to be. As Kayla Wright put it, "Sometimes I am so disconnected, I keep thinking that none of this is real. Everything is okay because none of this is happening. You aren't real, you aren't real, you don't exist. You do not exist." Over and over, like a broken record, there's no way to stop it. If I hold my hands out in front of me, then I'm sure they aren't mine. My insides are hollow with no feeling. Clients with BPD can be some of the most difficult to work with. As mental health professionals, we need to constantly work together in order to provide clients the treatment that they need and deserve. I have personally seen counselors burn out due to the severity of manipulation and behaviors that clients with borderline personality disorder have, and this can be ameliorated by using each other as resources. As long as we constantly strive to understand more about the history, diagnostic criteria, and treatment options, we have a great start. And most importantly, we should all strive to try and better understand the individual. Walking a mile in someone else's shoes can quite literally help save a life.